Hey, so this week I was in the PICU. Um, a little, a little hard for me, I think, but towards the end, it did get a little better. I was able to get involved with some of the other nurses in the unit and do some things with some of the patients that were a little less critical, um, that were in there due to just overflow. Um, like placement problems. So like there were some people that were in there that weren't actually ICU patients. They were regular floor patients. They just didn't have the room for them. So, so my patient today was a 16-year-old female. Um, she was she was admitted to the hospital on the 26th of September. She showed up with basically, she had been what they called car surfing. So I guess she was like riding on the top of a moving vehicle when she kind of lost her hold and rolled off, and then the car ran over her. She has a traumatic brain injury, so they had to do a craniotomy and remove part of her skull to release the pressure on the brain. So right now she's actually under sedation to kind of let her body heal and see, just kind of let her rest and heal, and then over time they'll probably take her off of sedation slowly and see where she is at. She is on a ventilator. She's pretty much hooked up to any tube that you could imagine right now. She has a drain that we had to keep an eye on that's coming out of her skull. It's basically continuously draining the fluid out of her brain. So that had to be measured consistently throughout the day. And yeah, just to make sure that the right amount of, not too much, not too, that it wasn't like blocked or anything like that either. So, so this patient was on several medications. She was on ciprofloxacin, dexamethasone combo. It was an eardrop. They're not exactly sure, but probably like she somehow suffered an infection trauma to the ear as well. So that was just something that they would put eardrops in. It's just to heal the inside of the ear, anti-inflammatory and an antibiotic. And then she was also on Keppra, just because this involves the brain and neurology. She's on an anti-seizure medication. She was also on IV fentanyl. She can't, the way that my nurse described it is that she cannot tell us that she's in pain. So the only way, they can just assume that she is. So she said that when a patient is under sedation like this, they automatically get put on a fentanyl drip. Maybe not always fentanyl, but in this case, fentanyl, to help with alleviate pain. And then she was on midazolam for sedation. That has to be watched closely because you run the risk of over-sedating, apnea, things like that. So, and then she was also on norepinephrine. They were actually titrating her off of that today. They didn't feel like it was needed anymore, that she's made the right progress. So they were slowly, in fact, it was like every 45 minutes they would take it down a notch, and then they would watch her, and then they would take it down again, and then, just watch that blood pressure, heart rate, make sure that there wasn't any issues with it. This patient is a full code status, so if there had been an issue, they would have called a code on her for full resuscitation measures. Trying to think of anything else. Yeah, she's just, it's going to be a long road to recovery. They aren't exactly sure the extent of the brain damage that she's suffered. They won't really know that anytime soon. She can move her arms and legs. She does not have a spinal cord injury. Her face was broken in multiple places, but she is able to move her arms and legs. So she's very lucky, actually. But she will, according to her doctors and her nurse, that she will recover. They just don't know to the extent of that recovery just yet. So, yeah, I had some other patients as well, but, I had a 14-year-old that overdosed on Tylenol that was in there. She had to have a sitter in the room, and they were waiting for psych for her, but just to name a few other things that happened throughout the day. And then my family from Tuesday that I saw was still there in the PICU as well. So it was a little emotional, but I don't know. That's that. So thank you.